Hello, Dr. Ferguson coming to you from the Passioncam. Hope everybody's feeling well today. We've been on a series talking about hormone balancing and primarily coming from a point of view of natural hormone balancing. So I'm going to continue on that line today, and I'm going to talk today a little bit about the younger person, the person that's having painful periods, excessive blood clots during the periods, irritable during the time of the period, just hard to get along with, those kind of things. Well, that can be treated. So don't just think because it's been so common amongst women. A lot of times I get patients in the office. What happens is things that are very common, people take it that it has to happen. Well, just because it's common doesn't mean it has to happen. So challenges during the time of your period, they don't have to happen. Yes, it is very common. And yes, it does get passed around that this is the way it is. And many women think that it has to happen, but no, it doesn't have to happen. We've had tremendous success in the office with the types of symptoms I just described by bringing the person's hormones in balance. I've treated patients probably as young as 13, as old as 99 for hormone imbalancing. But right now we're largely talking about the period, the irritable, the time of the period, things like that. I just want to talk a little bit more about that because it's not normal, although common, and it can be treated. And what happens when a lady's going through these different times of the cycle? At the beginning of your cycle, your body starts making estrogen, and towards the middle of the cycle, it starts making progesterone. And they have to be in balance. Again, we're talking about hormone balancing. So what happens is somewhere there's an imbalance in that process. And there's, as you go through that process, the imbalance is taking place, and so consequently you're having abnormal periods, you're having irritability, you might be having blood clots, you might miss a month for your period, but that says, all of those things say imbalance in your hormones. So what I do is I check the saliva testing, I see where your numbers are, and then I just treat accordingly. But for the most part, we can get those symptoms in check with progesterone, and I use it in the form of a cream. I don't use it in the form of a pill. The cream provided, who makes it, is many different people make it, and there's lots of different amounts in the cream. The one I personally use has about 1,000 milligrams of progesterone in 2 ounces, and that works very well in bringing the symptoms under control. Now, it's nice to do the saliva test first, so that I know exactly what I'm treating, but don't have to do it that way. But this is Dr. Ferguson coming to you from the Passioncam. I'll continue this next time. Bye-bye.